Postnatal depression is quite a well-known phenomenon, but prenatal depression isn't something that everybody's familiar with, and I know it can be a problem. Would you please tell us something about how it occurs?
Marina, I'm so glad that you asked me that question because, like you said, everybody knows about postnatal depression, but prenatal depression is not something that a lot of women know about, and yet it's so common. If we look at women worldwide, 10 to 15% of women suffer from prenatal or antenatal depression, and in some areas of the world, particularly in the developing world, up to 30 to 40% of women can suffer from prenatal depression. And if we look at risk factors for postnatal depression, one of the biggest risks for postnatal depression is in fact depression during pregnancy. It's really something that's very, very common. And often I think depression during pregnancy gets missed because we think that depression during pregnancy can be quite normal. You see all these adverts or sort of common myths talking about pregnant women being moody or pregnant women being emotional or teary,
Yes.
that kind of thing. But we don't realize that actually being moody or teary can be quite normal, but what's not normal is not to function, to be down all the time, to be upset, to be unhappy, to be anxious all the time. These are the things that are not normal, and these are the things that we need to look out for, and these are the things that women, partners, family need to keep an eye out so that we can get treatment and that we can help women with this.
Yes, many people make a joke of it.
Oh, completely.
And of course, it's not a good idea to do that. There may well be much more to it. And it can, of course, affect the fetus developing.
Absolutely. And in fact, there's lots and lots of evidence about how untreated depression and anxiety during pregnancy can affect the fetus. So, for example, things like low birth weight, increased rates of preterm labor, so that is labor before 37 to 40 weeks when we know that a baby should be born, increased risks of poorer growth after the baby is born. All these things can be associated with untreated depression during pregnancy. As I mentioned a little bit earlier, depression during pregnancy, anxiety during pregnancy are some of the biggest risk factors for postnatal depression. And we know that an untreated postnatal depression is one of the biggest risk factors for childhood developmental problems.
That's right. And so it is indeed a very serious potential problem that needs looking at. What have you found and what do you recommend, and how do people identify it? Especially because so many people say, oh, well, she's just pregnant.
No, completely. And I think that there are various different ways that we can look at it. I think the first thing is that if you're concerned about yourself, or that if you're concerned about your partner or your loved one, you should go and get help. And you can ask your general practitioner, you can ask your obstetrician or gynecologist, you can ask your nursing sister for advice. The second thing is that, in this online era, there are lots and lots of different tools, there are lots and lots of sites that you can look at that can provide you with advice. And some lovely sites that you could look at would be things like PSI, Postpartum Support International, which is one of the biggest sites that provide women with mental illness during pregnancy for support, and that would be psi.org. One of the nicest tools that can help you see whether you are depressed both during pregnancy and afterwards is a scale called the Edinburgh Depression Rating Scale, the EDS. And if you put that into any search engine, it'll come up, and you can either use a pen and paper version or an online version that scores it for you. And you could find that on a site like PSI, and that can tell you whether or not you are depressed, and that will help you seek help.
Dr. Bavi, could you enlighten us? What should family look out for in a mother-to-be who is behaving not in the usual way? She doesn't seem very happy, and she herself is not able to recognize what the problem is, because especially if it's a first-time pregnancy, you can just think that that's part of pregnancy. How would you recognize that somebody is in fact depressed clinically and possibly seriously?
I mean, there are various ways that it can show. The one way is that the person can be sad or down most of the day, nearly every day. The other thing is that somebody can lose interest or pleasure in activities that they previously enjoyed. For example, if somebody liked physical activities, they can stop doing that. Or perhaps more importantly in pregnancy, physical activities can stop because you're just physically uncomfortable. But more mental or more sort of crafty activities, somebody who always enjoyed sewing or knitting, or somebody who always enjoyed going to the movies or reading, just stops doing that kind of thing, doesn't take pleasure in stuff. Or maybe functioning, a woman who could run her household beautifully or cooked, who was amazing at her job, now stops being able to do that. Changes in mood, maybe not low mood, but being very, very irritable. Or somebody who becomes very, very anxious. A woman who could comfortably go out and shop and go out with friends now needs support to do something as simple as grocery shopping or going to the mall when she could do that comfortably before. Another thing that we often see is somebody who's constantly going to her gynae or her general practitioner or family doctor with lots and lots of sort of minor complaints, always worried about the baby, always worried that something is going wrong, and yet baby is absolutely fine. That should raise a red flag. These are the things that you can kind of look out for, and these are the things that should make family members or people around you or around the mum worried that maybe it's not just a physical thing, that this might be a depression or it might be an anxiety problem, and then to take it further.
Is there a particular stage during pregnancy when it's likely to manifest, or can it happen at any time?
The thing with depression and anxiety during pregnancy is that it can actually happen at any time during pregnancy. There's been lots and lots of work looking at, is there a specific time point? Is there a specific risk period where it may peak? And actually that there isn't. It really can happen at any specific time point. It can happen in the first, second, or third trimester. It is possible that maybe the first trimester is a slightly increased period of risk, and then again in the third trimester before the baby is born. And that might be because in the first trimester, at the beginning of a pregnancy, you might be a bit more anxious. And then again in the third trimester, just before the baby's born, again you're a bit more anxious. But it's not like we can clearly say that these are big periods of increased risk. It really is that there's, at any time point in a pregnancy, you can get an anxiety or depression. And also if you've had a previous anxiety or depression in pregnancy, it doesn't mean that, say you had depression or anxiety in your first pregnancy when you were 20 weeks pregnant and now you've passed 20 weeks, that you are kind of out of a safe period or you're out of your high risk period. It can really happen at any time. So it's important to be aware of that and not to brush off symptoms that happen either before or after a specific time period.
How long does it usually take before somebody recognizes it in the mother? Can it be overlooked?
It can often be overlooked, particularly during pregnancy, because, so often symptoms of depression can be physical. So whether it's in pregnancy or not in pregnancy, some of the core features of depression are actually quite physical. Fatigue, lethargy, changes in appetite, changes in sleep. These are all core features of depression, but they're all core features of pregnancy as well. So very often things that are features of depression get written off as features of pregnancy. So it's important when you are not feeling well, when you are feeling not yourself, when you're feeling down or anxious, or when it's your loved one who's feeling down or anxious or you're concerned, to actually make sure that they're getting help, and to make sure that when you are looking for help or when you're looking for help for your loved one, that the person who's caring for them actually asks about what we call the core features of depression or anxiety, the things that look at mood, anxiety, that they get asked about things like, are you feeling sad? Are you feeling anxious? Do you have interest and pleasure? Because that's what helps us separate between depression and anxiety and the physical symptoms of pregnancy.
What are the management options in prenatal depression?
There are many, many places that people can go to get help, and often where you go to get help can depend on where's the easiest place to get help. And when you're pregnant, the person that you're seeing most often can either be your midwife or your obstetrician gynecologist. And these tend to be the people that you have the closest relationships with. And that might be the easiest place for you to go to, but it's not, the first port of call should not be the last port of call. So if you're not feeling good and your midwife or your obstetrician is not helpful to you, you should keep going until you get help. So that might be that you get a second opinion, it might be that you see your family practitioner, it might be that you see somebody else in your area, but there are many, many other useful areas and other people that you can see. There are lovely, lovely support groups that are available. There is a really wonderful organization, Postpartum Support International, which is an internationally based volunteer support group run for women with depression during pregnancy and postnatally by women who have had depression and anxiety during pregnancy and postnatally. It's psi.org, and PSI runs volunteer support groups for women, and on their website they will have a list of support groups, and they will be able to link you with a group in your area, and if not in your specific area, we'll be able to provide some support for you and help you in finding somebody who can provide you with help and support.
But what about medical support?
And I'm so glad you brought up the issue of medical support, and in particular medication, because so many people think that medication is unsafe to use during pregnancy. I'm just going to go back a step because, obviously with depression being a mental illness or a mental health problem, psychiatrists and psychologists play a huge role in treating this illness. And with any form of illness during pregnancy, we want to be careful with medication, because any medication, be it something as simple as a painkiller or something for a cold and flu, you need to be careful about what you can use. So yes, our first line of treatment during pregnancy is always some form of psychotherapy. But many women who have depression and anxiety during pregnancy don't get better on psychotherapy alone. And here we've got to look at some form of medication. There are many, many types of medication that are safe to use during pregnancy. And here, your treating doctor or your treating psychiatrist will go through with you the pros and cons of each medication and help you make an informed decision about what's best for you and best for your baby.
If you've been diagnosed as having prenatal depression, does that mean you're going to get it again postnatally?
If you have prenatal depression, you are at high risk of getting postnatal depression. So about 60% of people who have prenatal depression go on to get postnatal depression. So yes, you're at high risk, but notice it's only 60%, it's not 100%. So it's not that you will definitely get it, but it is at higher risk. If you have prenatal depression, people often say, so will I get it in my next pregnancy? Again, you are at higher risk. So again, your risk is about sort of something between 20 to 60%. Other studies say to sort of between 10 to 40%. So we're not sure exactly how many women will get it in the subsequent pregnancies. The risk is higher than the normal population, but it's there. But it's not like if you've had it in one pregnancy, you will definitely get it in the next pregnancy. We know that it is a higher risk. And it's important for us to know that, so that one, we can look out for it, so that if it starts, we can catch it early and therefore treat it earlier. And also because we can then look at ways of trying to modify that risk to, in some ways, help you prevent getting it in the next pregnancy.
What are the causative factors?
For prenatal depression, it's really interesting because there are many causative factors, and We don't fully understand it, and we're also not sure if these causative factors apply to every single woman. What we do know is that probably the single biggest risk factor for getting a prenatal depression is a pre-existing history of a depression either in your previous pregnancy or a depression at any time in your life. The second biggest risk factor for getting a prenatal depression is a history of substance use or alcohol use. And we think that's because in women, the biggest risk factor for using substances, so drugs basically, or alcohol, is a history of depression or anxiety. Because in women, using drugs or alcohol is tied up very much with depression or anxiety, unlike in men, where alcohol use and drug use is often independent of depression or anxiety. Also, lack of partner support, lack of social support. And by lack of social support, I don't mean lack of money, because you can not have money and still be very supported by your family and your partner.
Indeed.
And you can have lots of money and not have partner support. Yes. So these all go together. There are also what we call biological factors, hormonal factors. You know, people often think pregnancy hormones, which is true, but it's not that there's kind of specific hormones. If you look at women who have prenatal depression and you look at their hormone levels, they're not different from women who don't have prenatal depression. The actual levels are more or less the same. We think what happens is that in women who have prenatal depression, uniquely sensitive or perhaps more sensitive to normal levels of hormones, or possibly the way in which the hormones are broken down in their bodies is different from the way in which women who don't have prenatal depression break down their hormones. What we also know is it's not just one factor. It seems to be a combination of factors. So it probably goes something like, well, you have a history of depression, you are not particularly supported by your husband, you break down hormones in a way that is different to, say, another woman. And the one thing that I forgot to mention earlier is that this is an unwanted baby, not an unplanned pregnancy, because many pregnancies are unplanned, but this is not a baby that you want.
Yes.
And all these interact and put you at high risk
Indeed.
for having a prenatal depression. So you see, it's this complex interplay of factors, and all of these go together to put you at risk for having prenatal depression and anxiety.
Thank you, Dr. Bavi. I'm sure that'll be most helpful to many women and families.
Thank you.